Hi, Doctor. I'm Nimisha from Noncodeio. It's an honor to have you here on our platform. First, I would like to introduce our company, Noncodeio and Love Heals Cancer. We guide cancer patients in their treatment journey. Our company aims to extend the life and improve the quality of life for cancer patients through an integrative oncology treatment, which includes complementary treatment and medical treatment. We provide end-to-end care to patients and also help with counseling, healing sessions, Ayurveda, medical cannabis, anti-cancer diets, awareness sessions, and pain and palliative care. This session is going to be all about spreading awareness and educating cancer patients. And for that, we have Dr. Srinivas with us. Let me take this opportunity to introduce him. So, Dr. Srinivas is a doctor in HCG Hospital in Medicare, Bangalore, and is known for offering excellent patient care. He's a specialized oncologist surgeon doctor offering a number of medical services. These include GI cancer, chemotherapy, cancer treatment, oral cancer treatment, breast cancer treatment screening, and hormone therapy for breast cancer, among others. Thank you so much, Doctor, for taking time out of your busy schedule to talk to us. And I'm sure a lot of queries will be answered through this session.
Thank you.
Yeah. The first question that I would like to ask is can you describe to us more about breast cancer and how much effectively one must effectively manage the symptoms and side effects?
Yeah, thank you for this wonderful introduction. I am a medical oncologist practicing in different hospitals in Bangalore. So usually breast cancer is the one which we commonly see in our, more commonly we see in our clinical practice, especially in women actually. So usually patients will come with breast cancer with a lump or swelling in their breast. So there may be a lump with skin ulceration or pain, something like that. Maybe they come with the symptoms, but most commonly they come with advanced stage to our clinical practice, because most of them they neglect the symptoms, and they, even though they notice the lump in their breast, they usually don't go to their medical doctor or medical consultation because of fear or social embarrassment, whatever it is. So usually whenever the patient comes with a lump in the chest or lump in the breast, usually we subject them to the mammography, and we take the we take the needle biopsy from that lump, and we will test what type of tumor. The lump may be non-cancerous also and cancerous also. So by the clinical examination itself, we can tell it is whether it is cancerous or not. And but more importantly, we need the needle examination. We take the tissue from that lump and examine whether it is cancerous or not cancerous. So once the tissue comes out in the microscopy, or the histopathology report comes out as a cancerous, then we will subject the patient for the CT chest examination, blood examination, other staging testing. Staging means whether the cancer is in the stage 1 itself. That means the cancer is only in the breast, or it has gone to different organs of the body. So in that case, it will be stage 4 disease. Suppose it involves the skin and other areas of the breast, then we call it as a locally advanced disease, or stage 3 disease actually. So depending upon the stage of the treatment, we plan the treatment. So we do some molecular testing and genetic testing for these patients also, and depending upon those things, we advise the treatment plan. So usually for most of all the breast cancers, there are surgeries, three modalities of treatment: surgery, chemotherapy, and radiation. So depending upon the stage, suppose patient is in stage 1 only, so then we advise them to go for surgery actually. Suppose patient is in a stage 3 disease, then we give some chemotherapy upfront, and then we advise them to go for surgery and then the radiotherapy. So most of the patients, whether they are in stage 1 or stage 4, they require all the three modalities of treatment, including the hormone therapy, depending upon the molecular test. So this is how we manage the breast cancer patient, any breast cancer patient.
So, how much do you think regular breast cancer checkups help in the prevention of breast cancer?
Yeah, that's what I was telling in my in previous question. So most of our, especially in India, most of our patients will present in advanced stage because they usually, because of social embarrassment or neglect the symptoms, they think that some of the myths that cancer causes pain, then only it is a cancerous. So these are the myths actually. So pain in the breast cancer comes only when it is an advanced stage actually. So early stages, it is the painless actually, painless lump will be there. So because of these reasons, most of 6 months to 1 year lump, they usually present when it is in advanced stage. When the pain comes, then only the patient will present to any doctor actually. So in compared to the Western countries, in India there are very few lesser number of breast cancers compared to Western countries, but death because of the breast cancer is more because they are presenting in advanced stage actually. Whereas in Western countries, the screening is more robust actually. So mammography, what I was telling, the mammography, it will detect this cancer in very early stage where we can cure the disease actually. So those screenings are not happening in our country actually. So usually most of our women must undergo screening procedure at the age of 45 years, especially if they have any family history of breast cancer. Even if it is not there, from 45 or 50 years of age, they can undergo the screening mammography. And from there, once in a year or once in 2 years, they can repeatedly undergo the screening mammography. So by this, we can identify the cancers at early stage, and we can cure that. Suppose it is detected, we can cure that breast cancer as such. Actually.
So, how is hormone therapy helpful in breast cancer?
Yeah, usually we have hormone therapy. As I told, we have surgery, radiotherapy, and chemotherapy for most of the breast cancer patients as a treatment. So hormone therapy is also one part of the treatment in breast cancer. So I was telling about molecular testing of each breast cancer patient. I was mentioning. So in that, usually we do ER positivity, ER receptor status, and PR receptor status in all the breast cancer specimen actually. Suppose ER is positive, that receptor status ER positive and PR positive comes, then the patient is eligible for hormone therapy. So usually we give this hormone therapy once patient completes surgery, radiotherapy, and chemotherapy is completed, and then the patient is put on hormone therapy for 5 to 10 years, depending upon the risk factors. So even patients comes in stage 4 disease, where patient we cannot do any surgery, it has spread to different organs of the body. There also, if patient is not having much symptoms because of the disease, there also we can subject the patient to hormone therapy if their cancer test positive for ER receptor and the PR receptor. So this is hormone therapy is, usually side effects are very less, can be taken at home, tablets are available, and this we can, then there is no need of any monitoring actually. Once in a month, they can just do the blood counts, and they can come back with the reports, or once after 3 months, we can review with the PET CT scan how they are responding actually.
So, like, what are the early signs of oral cancer?
So oral cancers, early signs, usually they will have sometimes ulcer in the mouth. Oral cancer may be anything, like tongue cancer may be there, the buccal mucosa may be there, or there may be we can call it as a gingivobuccal sulcus actually. So there any areas of this oral cavity can come up with cancer. Usually we commonly see whenever the patient is more commonly gutka chewing is there, or the tobacco chewing, especially in the females, and then smokers. So usually we commonly seen these type of oral cancers in India, especially in this group of patients. So they can come up with ulcers in the mouth, whether it is on the tongue or it is in the buccal mucosa, the covering of that oral cavity inside the oral cavity. So any ulcers they can present with, or with pain they can present with. So usually these are the symptoms of oral cancer. Usually they are early to predict, early to come for clinical clinical notice, because they can be seen and they can notice, and pain will come yeah, pain will come early actually. But in suppose we go to hypopharynx, we call it as a throat cancers, we call it as, or larynx, voice box cancer, we call it as. There the symptoms are a little bit hoarseness of voice will be there, pain will not be there during that time. So patients sometimes they neglect because it may be some throat infection and all. They usually present it at later stages of their cancer. So oral cavity cancers we usually come in the early stage because it is more easily noticeable, and pain usually comes very early in these group of cancers.
So, like, how one must effectively manage the symptoms and side effects?
So that's what I mean. Symptoms of oral cancer, once they notice, when they notice these symptoms actually, so they should go to the concerned doctor, especially the dentist or the ENT doctor. So they can get the biopsy from that lesion. They clinically examine the oral cavity, and they can get the, if it looks malignancy. I mean, it looks cancerous by the clinical examination. They can take the tissue from that ulcer, and we can subject for the testing. Suppose that comes as cancer, then we can do the further, like a surgery and whatever the staging procedure are available, so we can do accordingly. So sometimes it may be just tooth, the sharp teeth irritation and ulcer may be there. So in that case we have to identify what are the concerned thing, and we can rectify that. Suppose sharp teeth is there, then we can just with the dentist help, we can solve that problem, and the usually ulcer goes away actually. So depending upon the what is the triggering factor, we can identify the treatment. And more importantly, suppose it is an early stage, so we call, especially in the gutka chewing people, especially we see in adolescent young boys, where they have a lot of gutka chewing habits are there. We see commonly submucosal fibrosis, where it is also a pre-malignant condition, that is one step just behind that cancer, where they are not able to open the mouth completely as normal people do. So if it is detected in that stage and they quit the gutka chewing, then we can reverse that actually. So more importantly, whoever having the smoking or tobacco chewing, so it is advise them to quit this smoking or chewing habits as early as possible.
So, like, in what cases is surgery important?
So surgery usually, that's what in early stages itself we can do the surgery for most of the patients. So suppose it is advanced stage, we stage it similarly to the breast cancer, stage 1, stage 2, stage 3, and stage 4. Suppose it is in stage 3 and stage 4, sometimes we are not able to do the surgery. In stage 1 to 2, stage 1 to 3, we can do the surgery, and after that whether radiation is required for that patient, we can advise those patients depending upon the stage.
So, like, how can patients manage treatment-related side effects?
Treatment-related side effects regarding the chemotherapy?
Basically, overall.
Overall, yeah.
Yeah.
So surgery and all, I mean, post-operative follow-up will be there as per the surgeon's advice. And usually with radiotherapy, there may be, suppose to the oral cavity and regarding the throat cancer or oral cavity cancer, there may be sometimes during the radiation they may have oral ulcers actually. Oral ulcers, they may not be able to swallow because of the oral ulcers, that we will manage with symptomatically with the oral rinses and mouthwash and all. And sometimes because of radiotherapy and chemotherapy, there may be low blood counts also. During that time we usually avoid chemotherapy and radiotherapy till the counts improves, and then we restart the treatment. So most of the patients are able to tolerate this radiotherapy and chemotherapy for the oral cavity cancers actually.
So, what are the misconceptions with regards to cancer in society?
So I already mentioned one of the myth that pain. I mean, cancer is whenever the cancer is there, it usually comes with pain. So that is usually, especially in breast cancer, it is always a myth, because most of the breast cancers are always painless. Only in the advanced stage, when it involves the skin and subcutaneous tissue, then only it becomes cancerous. So that is one major myth most of the patients will have, and that's why they take the medical attention very late and they come with advanced disease. So other myths is patient thinks that if we I mean, if we talk to the cancerous patient or if we touch the patient, the cancer will spread to them. So that is not, that is also not correct actually. Usually suppose we could take it as oral cavity or the throat cancer exam, the throat cancer for example. So usually it is because of the smoking or achieving tobacco habit. So just touching the patient, usually cancer never spreads. And we take an example of breast cancer or lung cancer, so it is usually hormone related actually. So it doesn't never comes by touching or talking to them or sharing their plates, nothing will happen like that. And usually we have some cancers where it genetically transferred, we can genetically transfer. That is that accounts for around 5% of the total population actually. That depending upon the family history, we identify the patients and tell that okay, you are the one where you are at risk of getting cancer because your genes is tested for positive for the cancer. So this is one of the myth. So other myths is most of the patients think that cancer is a death sentence actually. So,
Yes.
so most of them they threaten. As I told earlier, if the disease is detected in early stage, stage one and stage two, especially in breast cancer and oral cavity cancers or throat cancers, it can be cured. Almost 70 to 80% cure rates are there actually. So, and suppose we take example of lymphoma or some leukemias, still we can some of them we can cure the disease actually. So, so cancer doesn't mean that it is always a death sentence actually. So most of the time, I mean, applying their knowledge and scientific scientific issues, then usually we can conquer the cancer actually. We should not most of the patients, they are afraid and they don't come to hospital, afraid of their chemotherapies, afraid of their radiotherapies and surgery. Most of them they don't come because some of them they hear other relatives that after taking this treatment the patient died, something like that. They hear and they don't come. So so what I advise is so please listen to your doctor and you come to treatment, because doctor will treat hundreds to thousands of cancers every day and in day in and out. So hearing to other your relatives or friends, don't decide on that your treatment plan. And one more myth, that's what I was mentioning. So chemotherapy will make them very weak. Chemotherapy treatment will make them weak. They're not able to walk and all. So it is not like that. So usually most of the patient they will decide about their treatment listening to their relatives or friends who have seen in their lifetime one or two patients. That's it. So they don't listen and they don't come to us fearing all these side effects. So please don't do that. You listen to your doctor. And we have seen that with chemotherapy and radiotherapy, most of our patients in early stages, we are able to control the disease, at least if we are not able to cure the disease. So, so I think these are the common misconceptions most of the patients will have. I think they should talk to their doctor before taking any decisions on their treatment plan actually.
So, how do you access a patient and determine what kind of treatment they require?
So it depends upon the staging of. I had told already. I think the staging of the disease we will do for any cancers, whether it is breast cancer or lung cancer. So if it is stage one disease, for example, we take example of lung cancer. Stage one disease, only surgery is enough actually, and most of the stage three and stage four disease require all the three modalities of treatment, like surgery, chemotherapy, and radiotherapy. So depending upon the stage of the treatment and depending upon the site of the treatment, we will decide the treatment plan actually. Suppose if it is only lymphoma and leukemia, only chemotherapy is required, no surgery, no radiation is required. Radiation only in some cases where it is very big tumor. So depending upon the diagnosis, site of the disease, and the stage of the disease, we will decide the treatment plan.
So, like you mentioned that follow-ups are required for surgery. So, how important is it for patients to stick to their follow-up plans post
Yeah,
surgery?
definitely. A post treatment, most of the patients they don't turn up actually. So usually for most of the patients, for first 1 year we follow up every 3 months, clinical
Okay.
examination every 3 months, and
Mm-hmm.
sometimes imaging testing we will do once in 6 months. So
Mm-hmm.
suppose that the tumor is tend to I mean chances of the risk of recurrence is more common with the tumor. We will be more vigilant of getting that cancer early if it recurs early. So patient and relatives should stick to the whatever the doctor has told the treatment follow up for that particular disease, and accordingly they should practice, I think, uh, to identify the any recurrence of the disease very early, and we can treat that also very early.
So, what should cancer patients keep in mind during COVID?
So the general guidelines for other general population, it will apply to them also, like wearing mask, keeping the social
Mm-hmm.
distancing, and sanitizing their hands regularly. Apart from that, patient usually the doctor always knows whether how intensely the treatment should be given. So usually during the COVID times, the intensity of the treatment we keep it at lesser, so that they are able to tolerate, and they will not the blood counts will not come down drastically, so that they may catch COVID. Apart from that, they should avoid a frequent visit to hospital. If oral treatment is possible, they should take oral treatment. And for the follow up with the doctor, if video consultation is available, that is possible. And more importantly, almost all patients, whether they are taking chemotherapy or not, so depending upon the blood counts, most of the patients, I mean all patients, require vaccination. Whatever we advise, that
Yeah.
vaccination is
Mm-hmm.
advised, except for some few conditions, where in leukemias and lymphomas, where some
Mm-hmm.
of the conditions are there, depending upon their doctor's advice, they can take in those their guidelines before taking the vaccination. But
Vaccination.
most of the cancers, especially the solid tumor cancers, lung
Mm-hmm.
cancer, oral cavity cancers, whether they are taking chemotherapy or not, the vaccination is must. It will prevent the severity of the disease, as such we have seen in our clinical practice.
So, can you please highlight the importance of self-examination and early detection?
Yeah, self-examination especially comes with oral cavity cancers, and also as well as the breast cancer examination. Oral cavity examination, they can look into the mirror and they can see, especially the chronic smokers or tobacco chewing persons are there.
Mm-hmm.
For there any ulcers or any discoloration in their oral cavity, they can see, and usually they can go to their respective doctor, like dentist or the ENT people, and they do the needful if they have any suspicion in any part of that oral cavity. Coming to the breast cancer examination, there are so many charts are available, clinical videos are available, where they can do
Mm-hmm.
their breast examination, and they can identify their lumps as such. So especially it should be done post I mean after 4 to 5 days after the periods. And what are the methods to palpate their breast? Looking at the mirror, most of the videos are available. They can look into it, and they can consult, and if there any suspicion is there, they can
Mm-hmm.
go to their concerned doctor for their further examination.
So, how do you think is the Nonco.io helping people?
Yeah, I think this is a very great platform for most of our patients to get educated themselves with all these videos and other educative materials to make them aware. Especially what I want to emphasize is the early detection. Early detection is more
Mm-hmm.
important. So whenever the symptoms are there, they should not neglect the symptoms. Any lump is there, any hoarseness of voice is there, any cough or any abdominal pain is there, they should not neglect their symptoms when it persists for more than 1 month. They should go to the concerned doctor and get it tested. And so more importantly, the quitting the smoking and tobacco. So most of our patients head and neck cancers or lung cancers are because of smoking. So they should quit their smoking habit or tobacco chewing as early as possible. And during these COVID times, I advise all of the cancer patients, whether you are taking treatment or not, so you should get vaccinated, except some few instances where you should consult your doctor whether you should take or not. So these are my advisors, and Zen Onco is, I think, it is doing wonderful job of spreading this awareness message for the cancer patients.
Thank you. Thank you so much, Doctor. Thank you for your valuable input and for being with us today's knowledge sharing session. And I'm very pleased that you took time out of your busy schedule to be with us and to share so many insights. I'm sure so many people will have benefit from this session. Thank you once again for joining Zenonco.io and Field Scans.
Thank you.